Back of the body and scapular region. Let's discuss about the trapezius muscle. It is a triangular muscle on the back of the neck and upper thorax. Origin of the muscle. It arises from the medial third of the superior nuchal line, external occipital protuberances, and ligamentum nuchae, spine of 7 cervical vertebrae, and spine of all thoracic vertebrae from T1 to T12. Insertion. It has been divided into three fibers: superior, middle, and lower fibers. Superior fibers are inserted into the posterior border of the lateral third of the clavicle, and middle fibers are inserted into the medial margin of the acromion and upper lip of the crest of spine of the scapula, and lower fibers are inserted into the deltoid tubercle. Nerve supply of the muscle. Motor supply is provided by the spinal part of the accessory nerve, and proprioceptive sensation is provided by the ventral rami of C3 and C4. Actions. Upper fibers will assist in shrugging the shoulder, and middle fibers bracing back the shoulder, lower fibers in depressing the medial part of the spine of the scapula. Latissimus dorsi. It is a wide, flat, triangular muscle in the lumbar region and lower thorax. It is mostly superficial except a small portion covered posteriorly by the lower part of the trapezius. Origin of the muscle. T7 to T12 from the tendinous fibers and posterior lamina of thoracolumbar fascia from tendinous fibers, and outer lip of posterior part of the iliac crest from muscular slibs. Fleshy slibs from the lower 3 or 4 ribs, dorsal surface of inferior angle of the scapula. Insertion. From its extensive origin, fibers pass laterally with different degree of obliquity, which is inserted into the floor of endotubercular sulcus of the humerus. Nerve supply. It is supplied by the thoracodorsal nerve. Its root values C6, C7, and C8 from the posterior cord. Actions. It helps in adduction, extension, medial rotation of the humerus. It pulls up the trunk upward and forwards while climbing, swinging of arm, and it assists in walking. Violent expiratory effort. Clinical aspect. Musculocutaneous flap of latissimus dorsi is often used in reconstructing a breast following mastectomy. The latissimus dorsi can be used as autotransplant to repair a surgically removed portion of heart, and it requires a pacemaker. Rhomboides major muscle. Origin of the muscle. It is from the spine of T2 to T5 vertebra and supraspinatus ligament. Insertion. It is inserted into the medial border of scapula between root of spine and the inferior angle of the scapula. And nerve supply of the rhomboides major. It is supplied by the dorsal scapular nerve. Its root value is C5. And the actions of the rhomboides is retracting the scapula as in squaring of the shoulder. Triangle of auscultation. It is a small triangular gap in the musculature on the back of the thorax near the inferior angle of the scapula. Its boundaries are superior horizontal boundaries, border of the latissimus dorsi, medial border of the scapula, inferior lateral border of the trapezius. The floor of the triangle is formed by the 6th and 7th ribs and 6th intercostal space. Its main significance is the upper part of the lower lobe lies deep to the 6th intercostal space. Deltoid muscle is a 3-in-1 muscle. It has been divided into anterior unipinnate, posterior unipinnate, and middle multipinnate. Origin of the muscle. Anterior unipinnate arises from the upper surface and anterior border of the lateral third of the clavicle. Middle multipinnate arises from the upper surface of the acromion. Posterior unipinnate arises from the crest of the spine of the scapula. Insertion. All these will be inserted into the V-shaped deltoid tuberosity in the lateral aspect of the midshaft of the humerus. Nerve supplies by axillary nerve C5 and C6. Actions. Anterior fibers help in flexing and medial rotation of the arm. Middle fibers help in abduction 15 to 90 degree, and posterior fibers help in extension and lateral rotation of the arm. Structures under cover of deltoid muscle: bones, humerus, acromion process, joints, shoulder joint, and ligament, coracoacromial ligament, and bursa, subscapular, subacromion, and infraspinatus bursa, muscles. Insertions of pectoralis major, minor, teres minor, latissimus dorsi, and sits group, and origin of biceps, coracobrachialis, and triceps. Vessels PCH and ACH, nerves, axillary nerve, spaces quadrangular intermuscular spaces. Rotator cuff is a name given to the tendons of supraspinatus, infraspinatus, teres minor, and subscapularis, which are fused with the underlying capsule of the shoulder joint. The primary function of the rotator cuff muscles is to grasp a relatively large head of the humerus and hold it against the smaller and shallow glenoid cavity. Now we will be looking into the sits muscles positioning. Supraspinatus located superiorly, subscapularis located anteriorly, teres minor and infraspinatus located posteriorly. So movements of the scapula. The protraction, it is mainly assisted by the serratus anterior pectoralis minor muscle. Retraction by trapezius middle fibers, rhomboides minor and rhomboides major. Elevation by trapezius upper fibers and levator scapula. Depression pectoralis minor, trapezius lower fibers, latissimus dorsi, and medial rotation by levator scapulae, rhomboides minor and major, and lateral rotation by trapezius upper and lower fibers and serratus anterior. Subscapular intermuscular spaces. And the main important one is the quadrangular space. Its boundaries are superiorly teres minor, subscapularis, and capsule of the shoulder joint. Inferiorly teres major, medially by long head of triceps, and laterally by surgical neck of the humerus. Structures passing through these spaces are axillary nerve and posterior circumflex humeral artery and vein. Axillary nerve, it arises from the posterior cord of the brachial plexus near the lower border of the subscapularis. It runs backwards on subscapularis to pass through the quadrangular space along with the posterior circumflex humeral artery. Here it is intimately related to the medial aspect of the surgical neck of the humerus, immediately inferior to the capsule of the shoulder joint. The nerve gives a branch to the shoulder joint and runs laterally to divide it into anterior and posterior division. The posterior division will provide nerve supply to teres minor muscle and posterior part of the deltoid and continues as upper lateral cutaneous nerve of arm. An anterior branch will provide the insertion to the deltoid and cutaneous branches of the skin. Damage to axillary nerve can lead to impaired abduction of shoulder due to paralysis of the deltoid muscle, loss of sensation of the lower half of deltoid, regimental patch, loss of shoulder contour with prominence of greater tubercle of the humerus.